Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Miracle Diala. He is a medical student and he co-wrote the Kevin MD article, Stuck Between a Virus and a Cold Place, a choice for homeless Americans awaits. Miracle, welcome to the show.
Thanks for having me on, Dr. Poe.
So we'll get into that article in a little bit, but first off, can you share your story and your journey to where you are today?
Yes, so I suppose my story would start about 10 years ago. Come from a Nigerian family, and as Nigerian families go, they tend to push you into fields such as medicine, engineering, the like. But I wanted to make the decision for myself. And so that decision came after I had a posterior spinal fusion. So went through that, spent 8 hours being operated on, rested for about a week in a hospital and 2 months afterwards. And after that, I started to think about what I wanted to do, connected with my surgeon and all the medical staff so well that I figured that I'd want to go into medicine and be able to do for others what the staff were able to do for me.
Excellent. And from that procedure, talk about the perspective that it's given you going through your medical school journey.
Having gone through that procedure, it's definitely given me an eye for being able to understand the healing process and how difficult it can be from a medical and personal and social aspect. And I think it's what it's going to do for me is be able to give me a certain level of perspective because the specialty I'm actually aiming for, as of right now, one of my choices is physical medicine and rehabilitation. So I think having gone through what I've done, what I have will give me a better perspective once I am eventually treating my own patients.
Fantastic. And best wishes going forward.
Thanks.
So let's get into that Kevin MD article that you co-wrote, Stuck Between a Virus and a Cold Place, a choice for homeless Americans awaits. Now, for those who haven't read the article, can you just walk my audience through it and share the story of why you decided to share it?
There was a group project that was assigned to a number of us in our global medicine program. And so we were given a variety of topics. And one of the topics was how the COVID pandemic would affect the homeless population. And so after I saw that, I was immediately drawn to it. And so I, along with my co-authors, Christopher Urena and Marina Lenskovic, we decided to tackle this project, looked at various aspects of how different homeless shelters across the states have been tackling the issue and the potential problems that they'd be coming up across. And so we just wanted to take all that information, summarize it, that way that anyone else who happened to be interested in the topic or wanted to contribute in some way would have at least a baseline amount of information to go off of in order to enact their own plans.
Excellent. So let's go into the article. So tell me, how has the pandemic affected the homeless population?
It's difficult to put yourself in a situation in which you've lost your job and you're facing homelessness. And this is something that a great amount of people have been facing due to the massive amount of job loss that has happened since the start of the pandemic. And so my immediate thoughts upon seeing this would be how would the how would the systems be able to hold up in order to help these people who are disadvantaged? And especially as time has gone on and more jobs have been lost, I believe the last month's jobs report was fairly poor, and quite a few people are facing evictions. This is a problem that's only going to be increasing. So upon realizing that, I was drawn to being able to at least write about this issue. That way, as many people knew about it as possible. And I think it's going to become more of an issue coming into 2021 as the lockdowns continue. We have a new strain coming out, and that's going to impact quite a bit of things, both on the economic side and the health side.
So tell me about the intersection between the economic side and the health side. Through your research, did you come across any stories of examples of people being affected by this, the homeless population, and how that affected their health?
So a friend of mine that I know personally, actually, his family business, his father's family business, was actually being greatly impacted. It had to do with it had to do with construction and maintenance of buildings. Well, since quite a few buildings had been closed due to the pandemic, his family wasn't receiving as much business, and so he had told me that come holiday time, around this time, his company would probably end up running out of money,
Hmm.
and he would be in dire straits. And so it was after he had told me that story that I started to gain an interest in the intersection between health and economics because his family has been doing everything they can to be safe. They have quite a few people who are vulnerable in his family. And so he understands the importance of staying safe during these times. But at the same time, there's another threat on the horizon for him. And so that started getting me into it. It's actually one of the things I plan on reading about after boards is over, both the impact of COVID on the health system and the economy, as well as going forth, looking for different systems that could possibly address this intersection a little bit better and help prevent people from falling into this precarious situation in the first place, or if they do, being able to help them out of it as much as possible.
So going forward, what are some of the proposed solutions to solve some of the issues that you're talking about?
So as far as the article that was written, there were a few solutions that were presented. The most economic one that was presented, because different homeless shelters are going to have different budgets, obviously, would be to try to see if there was a way that they could expand space, expand bed space for individuals that happen to come in, and then have a very strict policy as to if you leave, then you're not allowed to come back without being
Mhm.
properly tested. That's what a few homeless shelter systems had done. A few others, they had attempted to try to install an HVAC. HVACs are obviously more expensive depending on the building size and whatnot, and so that's also a proposed solution. I think the best solution and the most economic solution of having a very strict policy as to who can and cannot leave would be smartest to have for now, but especially now that our mild winter is probably going to start getting our relatively mild winter in the Midwest is probably going to get a little bit more intense in the coming months. That is something that may or may not be sustainable long term.
We're talking to Miracle Diala. He is a medical student and he co-wrote the Kevin MD article, Stuck Between a Virus and a Cold Place, a choice for homeless Americans awaits. Miracle, you mentioned some solutions from a governmental standpoint in terms of funding and whatnot, but from an individual standpoint, medical students, clinicians, physicians, what are some things that we could do to help address this issue?
So I definitely think in our community as clinicians, medical students, the like, we can do our best to reach out.
Mhm.
I've heard of a few homeless shelters wanting to work with vaccine implementation. And so I know a few students from my school, they were already first in line to get the vaccine and offer to distribute the vaccine. So I think that's what we can do on a personal level. I think from the clinician view, being able to understand that an increasing amount of people are going to be put in a precarious economic situation that may want to impact the route you go about in prescribing treatments. Definitely, definitely stressing preventative medicine methods such as increasing exercise, bettering your diet, especially given that one of the vulnerable populations for COVID are obese people.
And if you wanted to learn more about this issue, what are some of the resources that you found during your research and some resources that you could suggest online?
I looked at a number of databases online, learn more about the intersection between homelessness and health, for
Mhm.
one, and then for other, being able to do more sociological research, look at more sociology research about food deserts, for
Mhm.
example, because many individuals who are being put out on the streets, they're not able to access quite a bit of food themselves. So being able to look at food scarcity and how that affects different populations, doing looking into research articles on that would be helpful, I believe.
Sure. And my final question, what's your take-home message you want to leave with the Kevin MD audience?
My take home message is just to definitely be more mindful. I think that as a medical student who I, for one, I'm receiving some money through scholarships, some money through student loans, I'm in a more privileged situation economically than others. And I think other physicians, given that the healthcare industry is known for having better job security, I think being mindful of our privilege financially in this particular pandemic would be very helpful, and definitely carry that as you treat different patients of different financial backgrounds.
Miracle, thank you so much for sharing your time and insight. Thanks again for being on the show.
Thanks for having me.